This is Dr. Paul Firnhaber. It's Wednesday and time for 10 minutes of truth. Well, as usual, I have another exciting and important journal article that I want to discuss with you. This particular article came out in November of last year, November 7th, 2024. And it's in a journal called Brain Science, which is a high quality neurological research journal. The name of the article is Neuroplastic Responses to Chiropractic Care: Broad Impacts on Pain, Mood, Sleep, and Quality of Life. So the objectives of this study were to elucidate the mechanisms of chiropractic care using EEG, electroencephalography, clinical health assessments, patient-recorded outcomes, and somatosensory evoked potentials, meaning the quality of nerve impulses going from the brain to the body and the body to the brain. So they looked at certain objectives, okay? They had 76 people, 38 in the chiropractic group and 38 in the control group. And they looked at EEGs, they looked at patient-recorded outcome measurements, and they looked at pain intensity scales. And the chiropractic group was 38 people who was adjusted 3 times a week for 4 weeks. And the control group had usual care, which was any recommended or prescribed by non-chiropractic health providers for chronic lower back pain, including self-management, advice, pain drugs, physical therapy, or a pain clinic. Now, one of the things they looked at was EEG measurements, electroencephalography, looking at brain waves. So let me just go over the 4 brain waves they looked at and what they do. First was delta waves. These are very slow waves, and you see these when you're sleeping. Then there's theta waves, which is slow brain waves, seen when you're daydreaming or in your twilight states or when you're in state of meditation. Then there's alpha waves, which are seen during relaxed states when the brain is active but relaxed. Say maybe, when you're watching a movie or, when you're just relaxing and having a conversation. And then there's beta waves. These are fast brain waves. And they're seen during concentration, mental work, conscious thought, and logical thinking. So they wanted to look at what happens when you correct a vertebral subluxation, what happens to brain function, and what happens to neurological function. And what they found, first of all, when you have a vertebral subluxation or misalignment in the spine, putting pressure, maladaptive pressure on the nervous system, this actually makes, over time, maladaptive changes in the central nervous system. In other words, the central nervous system, brain and spinal cord, begins to change for the worse. Chiropractic adjustments, according to this article, have been shown to influence various aspects of neurophysiology, including somatosensory processing, in other words, how you process pain, sensoromotor integration, which is hand-eye coordination, motor control, and everything crucial for executing motor tasks accurately. Now, the 2 areas of the brain that are most affected by subluxation are the prefrontal cortex, which is right here, and the cerebellum. And they influence emotional control, mental health, as well as neuroendocrine responses, autonomic nervous system function, and immune function, which is a lot of what goes on in your body. So these 2 areas, your prefrontal cortex and your cerebellum, are greatly influenced by a chiropractic subluxation. And they go through negative changes over time the longer you're subluxated. So the findings of this study, which were pretty interesting, it said resting EEG showed significant increase in theta, alpha, and beta waves and a significant decrease in delta in the chiropractic group post-intervention. Significant improvements in light sleep stage were observed in the chiropractic group, along with enhanced overall quality of life post 4 weeks when the study ended, including significant reductions in anxiety, depression, fatigue, and pain. So one of the things they're finding is that chiropractic care not only improved symptoms of pain and unpleasantness, but also resulted in improvements in mood and anxiety and fatigue. And this article says long-term chiropractic care for chronic low back pain may significantly lower rates of hospitalizations, emergency department visits, advanced diagnostic imaging, specialist visits, lumbosacral surgery, interventional pain medicine techniques, and just a reduced escalation of care. Now, one of the things that the people wore in this study was Fitbits, and the Fitbit was to determine how well they slept. And Fitbit data revealed that the light sleep stage significantly increased in duration in the chiropractic group over the 4 weeks of the study, which is very interesting, indicating that chiropractic adjustments help to alleviate tension from within the body, encouraging blood flow, enabling the muscles to relax, and making it easier to also mentally relax and fall asleep. Chiropractic care may potentially prevent pain from being chronic, and the current study provides some insight into the mechanisms of this phenomena. Ongoing chiropractic care, according to this article, even after the initial pain symptoms improve, will likely continue to impact somatosensory networks, thus maintaining positive neuroplastic changes, meaning good changes in the brain and central nervous system, and prevent such escalations of care, worsening of symptoms, and decreases in quality of life. So the conclusion is this: many health benefits of chiropractic care are due to altered brain activity. So it's how chiropractic care affects the brain. So this article is a further proof that when we adjust somebody, we're profoundly affecting the nervous system. And over time, we're creating neuroplastic or positive changes in people's brains, which with ongoing care can last and even get better over time. So another article really elucidating and explaining the science behind what happens during a chiropractic adjustment. One of many articles that I've covered. So I hope that this article helps you see like the neurological benefits of what we do, and the fact that there is lots of science behind and undergirding chiropractic care. And if you're interested, and I would say it's really important just to get checked out by a chiropractor to see if chiropractic can help you. We do that here in our office, and if you're interested in getting checked, and if you're not under chiropractic care, I would certainly recommend at least getting checked. You can call our office at 402-488-2220. And we do very low force chiropractic care here, along with functional medicine and clinical nutrition. And these are modalities that can really, really help prolong your life, prevent disease, and correct the underlying causes of problems that you may have suffered with for a long time. So stay safe out there, take care of yourselves, be healthy, and again, if you want to get checked just to see whether chiropractic can help you, we do that at our expense. About a 10-minute what we call a pre-exam. We'd love to do that for you. So I'll see you next Wednesday.